part 2 of my 6-part web series on Lamaze Healthy Birth Practices, walking, moving around, and changing positions during labor. Let's help that baby move through the pelvis. The rebozos, working on the birth ball. What do we think of when we think of labor and delivery? For the most part, in the United States, most women give birth on their back in the hospital. But lying on your back is the worst, most uncomfortable, and most inefficient way to birth. Where does that come from? You will be surprised to find out that the first recorded instance of a woman giving birth on her back is mistress of King Louis XIV in 1663. Actually his choice so that he could watch the baby emerge from behind a curtain. It used to be forbidden for men to be present during labor during that time. And when forceps came into play, it became easier for the doctors if a woman gave birth on her back for his convenience. The truth is, it is beneficial for you to walk and move around and change positions during labor. How does this work in your favor? How about gravity? Gravity moves downward, and when you're standing or squatting or on all fours or walking around, gravity is helping to move downwards. When you're on your back, gravity is working against what your body is doing. How about your pelvis? Here's your pelvis. If you're on your back, look what's in the way. Your tailbone. That opening is just so much smaller. Think about how baby has to travel if you're on your back. It has to travel upward. Now think about giving birth on all fours. Suddenly, your pelvis is opened up and baby can go work with gravity to move down through the pelvis. And if you want a frontward facing view, your tailbone is out of the way and baby can move on through. And moving around and changing positions during labor allows for better alignment. Your body is working with the way that the baby is moving down and allowing that baby to travel downward through your pelvis. Standing or side lying or squatting or forward leaning, there's no constriction of blood to your baby, and that way your baby doesn't become distressed and baby is happier and you guys can work together. Talk about lilt birth and being a lively dance between mom and baby and the cues that go along with dancing between mom and baby, and mom listening to the cues of the baby and the baby listening to mom's cues. You can go into birth with confidence if you know that you can listen to your own intuition. You can listen to what is comfortable for you. Not every woman will find that laboring on her hands and knees is the best position for her, or laboring on her side is the best position, or not every woman will find that walking through labor or squatting to deliver her baby is the most comfortable thing. But each woman should have the freedom to find which position is most comfortable for her. Watching these videos and you're preparing to give birth, now is the time to think about and try some of those positions to feel which ones make you feel as open as possible. Start preparing your body now. The end of pregnancy for labor. Practice beforehand your body positions. And as you're practicing those different positions, see how they make you feel. Does your pelvis feel open? Are you relaxed? If you're not sure, try tensing up during those different positions and see the difference between tense and relaxed. If a certain position is making your body, your muscles down there feel tight and tense, if it's making it feel very closed, then perhaps try something different. What are some of the things that can keep women from walking around during early labor, or intravenous line, or continuous fetal monitors? You don't need to be hooked up to an IV or continuous fetal monitoring. Ask for portable equipment to see if that is available. Or an alternative to an IV is a saline lock. An alternative to continuous fetal monitoring is intermittent fetal monitoring.
So I'm going to show you a few positions on the birth ball and without the birth ball that you can do during labor if you are free to move around. To make things a little bit more comfortable, open up your pelvis and let gravity help baby move down.
So move in circles. You can sway from side to side on the birth ball. Lean over the birth ball. It's a great tool to have during labor. Lean over a buffet table. Sit backwards on a chair, all fours, and sitting with your pelvis open. There are also a lot of great positions that can be done with partner support. You can use a rebozo scarf or a pashmina scarf to do abdominal lifts with your partner. I'm going to quickly show you 2 positions that you can do with your partner through contractions. This is called the slow dance, and the second is one of my favorite, is the dangle. Give some of that weight to your partner. So I hope this video helped encourage you to try some positions and to walk, move around during labor. Next week we'll be talking about the birth practice number 3, having a support person, loved one, family member, or doula for your labor.